we look at the gold standard treatment nowadays, heart failure patients rely on the potential heart transplantation based on the fact that nowadays there is no other way to treat besides using some drugs to overcome the limitations of a failing heart. But ideally, a heart transplant is what patients are waiting for. And many of them actually they successfully receive a heart transplant. But the problem, following the conversation with lots of clinicians, is based on the fact that the heart transplant is not the optimal solution for these patients, based on the fact that we do know that there is a risk of rejection, the need for long-term immunosuppression, and also limited matching between, for instance, the morphology of the donor and the receiver. Therefore, we try to understand on how to utilize a tissue engineer approach, or how to develop a tissue engineer approach to promote the formation of an optimal heart tissue that can be transplanted into the patient to replace the damaged tissue. Now, obviously, this is a very ambitious project that has been taking together different expertise, as I mentioned before. At the same time, we had to, before we jumped into starting our project, we had to identify what were the major challenges, as you mentioned. So one of the major challenges for us was the better recapitulation of a proper vascular network. As I mentioned to you earlier, and based on the fact that the heart comprises blood vessels of different types, not just one capillary, one artery. There are so many different levels of complexity within the heart tissue that they need to be replicated also in our tissues that we generate in the lab. At the same time, another major challenge is based on the fact that the contractile activity of the tissue that is going to be transplanted should match the requirements of the host tissue, based on the fact that transplanting a beating patch that is not able to integrate properly with the receiving heart. In that case, what we develop is what is called arrhythmia. So this is not just specific for heart patches or bioprinted, bioengineered heart patches. It happened for many years following the injection of single cells. So based on the fact that cells, they are not easily able to integrate following the delivery in the host tissue. So these are the major challenges that 3D bioprinting or a bioengineered tissue that is able to overcome both the vasculature and the contractile activity of the desired tissue is something that we've been working on in the past years. And I may also touch on another aspect of the challenge here, based on the fact that eventually it's not going to be an expert in tissue engineering that is going to transplant the patch. Therefore, it is really critical that we are able to create a network together with the clinicians to better translate our research from the bench to the bedside for the optimal outcomes for the patient.